Hello and welcome, my name is Chris from christopherhole.com. Welcome to this video where we're going to be looking at the lateral ankle sprain in this little injuries and rehabilitation series of videos. Now we're going to cover quite a lot in this. Again, don't worry too much about the sort of technical jargon that I use. The main thing is to sort of understand the principles. So things we're going to cover are sort of the tissues involved, which is why we've got this screen, this picture here, and this picture here on the screen. And then we're going to look at treatment. So this might be treatment that you give yourself, or it might be treatment that another health or sort of rehabilitation specialist will prescribe to you. This is for educational purposes. You may well use it to better understand what the therapist is sort of prescribing you, and you may use it as a way of making sure that they're sort of giving you the right treatment. It might not be specifically right. I'm not going to cover everything that could be done, but it will certainly give you an idea of what is available with regards to different types of treatment. So tissues involved, or first of all, the lateral ankle sprain, as you may well know, because you may well be watching this with a lateral ankle sprain, is when you go over on your ankle and this outside part of the ankle becomes stretched. Now, when it becomes stretched, there are three main ligaments that are involved, which is the posterior talofibular ligament, or PTFL, and then the anterior talofibular ligament, ATFL. So the anterior one sits on the front of the ankle, the posterior one sits on the back of the ankle, and then you've got the calcaneofibular ligament, which is the CFL, which is this ligament that joins at the bottom of the fibula here and the top of the calcaneus here. The muscles involved aren't necessarily all of the muscles on the outside of the leg, because what you'll find is the tibialis anterior, the peroneals longus, they start on the outside of the leg here, and then they go across the foot onto the inside part of the foot. So they start up on the condyles of the tibula, the lateral condyles. They go across the leg, and then they join in at the base of the first metatarsal and the medial cuneiform, which are bones of the feet. The peroneals longus starts on the fibula head, which again is on the outside, but then crosses the foot and joins in roughly the same place on the first metatarsal and the medial cuneiform again, so they're going across the body. The ones we may want to look at are the peroneals brevis, which starts on the fibula, goes down, and then that joins on to the fifth metatarsal, and then the flexor digitorum longus and the extensor digitorum longus. So muscles down the outside of the foot, there are some specific ones. So you might want to look into more depth as to which ones those are, because they might be the muscles that need to be treated. But certainly these three ligaments here on the outside of the ankle will need to have some attention to them. So with regards to treatment, first of all, we would rice or police. So we would make sure it's cooled, make sure we get any bruising out, make sure we prevent any further bleeding, elevate compression during the inflammatory phase. Then we get early onset mobilization, so we want to keep it moving to some degree, because that, again, that's going to help our proprioception our healing. And then we've got light passive stretching. Then we come on to proprioception. Now, proprioception is the stability of the ankle, or the way the muscles function around the ankle to keep it upright. Then we want to start strengthening the surrounding tissues. So all these muscles I've talked about, even the ones on the back. So you've got the gastrocnemius, soleus, which is a bit further down. All of these muscles are going to need to be strengthened to a degree. They're going to need to be also massaged to a degree to remove any existing tension. And then what we've also got are some deep frictions. Now, with regards to deep frictions, that's when someone might put your thumb into a muscle or into a tissue, and it might be quite painful and acute. Now we want to certainly deep friction into these three ligaments here. The reason being they can become stretched and damaged, and ligaments don't get a massive blood supply, certainly not as much as muscles. So by sort of frictioning or deep frictioning these tissues, we can encourage some more blood supply to aid the healing process. So it's quite a simple recovery or rehabilitation, uh, but it needs to be done in the correct way. So things we need to be thinking about, obviously, first of all, we need to rest, ice compression, and elevate. That's only initially. Then we get the next sort of 4 bullet points, which is keep it mobile, so keep it moving. It doesn't have to be loaded, so you don't need to be stood on it. It could be elevated and you're just moving your foot back and forwards. Some light stretching, some proprioception, so just working on making sure that the stability of your ankle is still there. Some strengthening exercises. And then during all of this, you want to be getting some sort of manual therapy. Again, it doesn't matter which one it is, but thinking about things like deep frictions around these ligaments on the outside of your foot. Okay, great. So I think that pretty much covers it. It's very much an overview, so do take that on board. It is only an overview. It's not a deep, in-depth presentation on how to overcome lateral ankle sprains, but there is some useful information in there. Hopefully you can make use of it. My name is Chris from ChristopherHole.com. I'll speak to you in a future video.